She's the girl that no one ever knows. And I say hi, but she's too shy to say hello. She's just waiting for that one to take her hand and shake her up. I bet I could. I wish my heart was always on her mind, 'cause she's on mine like all day, all the time. Yeah, forget.
Done with the cute scene, now back to the learning. Injure recovering with major in fractures and bone remodeling. A fracture is a medical term of bone. Fractures are common. They occur when the physical force exerted on the bone is stronger than the bone itself. Forearm fracture is a common fracture during the age of 50 to 60. Humans will undergo vertebral fracture in the lifetime 60 to 80. At the age of 80, there is a high risk of hip fracture. There are many types of fractures, but the main categories are displaced, non-displaced, open or simple, and closed or compound fractures. Displaced and non-displaced fractures refer to the way the bone breaks. Simple fractures are fractured bone end that does not penetrate the skin, and compound fractures are fractured bone end that penetrates the skin, which is cause serious injury.
The names of fracture in simple fractures are transverse fracture, oblique fracture, spiral fracture, comminuted fracture, segmental fracture, avulsion fracture, impact fracture, and greenstick fracture.
There are 4 stages in bone remodeling. The first stage is inflammation. There is hematoma formation at fracture site. Tissue in fracture site is swelling, very painful, obvious inflammation, and bone cells are dying. Then, white blood cells move into the area to clean up debris created by the break. This creates inflammation, which triggers the growth of new blood cells. The second stage is soft callus. As blood cells divide and multiply near the break, new blood vessels develop to fuel the repair process. Fibrocartilaginous callus develops over 3 to 4 weeks. This process involves capillary growth in the hematoma, white blood cells invading and cleaning up debris in injury site, fibroblasts and osteoblasts migrating into the site and beginning reconstruction of the bone. The third stage is hard callus. Hard callus begins forming after 3 to 4 weeks after injury and is prominent 2 to 3 months following the injury. Continued migration and multiplying of osteoblasts and osteoclasts result in the fibrocartilaginous callus turning into a hard callus. This stronger callus creates a bulk at the site of the fracture. It can be seen by X-ray just a few weeks after the bone fractures occurs. The last stage is remodeling. In the final stage of bone fracture healing, the body replaces old bone with new bone. Any excess material of the bony callus is removed and compact bone is laid down in order to reconstruct the shape. Remodeling makes bone stronger and more compact, and the blood circulation in the bone improves. We should take some actions to get better from the injury. So, what should we do? Avoid tobacco products which can slow down the healing process. Eat a well-balanced diet for the energy and nutrition healing bonds needed. Increase your intake of calcium, which helps build the strong bonds. Only take the pain relievers as directed. Certain anti-inflammatory medication can inhibit your body's ability to heal the breaks. Get plenty of rest. Your body is working hard to heal and needs recovery time. Follow your doctor's instructions to give yourself every opportunity for successful healing.
Today I threw